Hello again. This is Professor Keeney. Today we're going to talk about activating the plan during a crisis, and our first part for Module 3 talks about the process, teams, and working with other organizations. So, as I've said in earlier slide sets, before the disaster drills, you really cannot get enough practice because you never know what the disaster is going to be, so it's good to practice with different types of disasters. And so we test our plans before a disaster strikes, so everyone in the organization knows what to do, hopefully, when the disaster occurs. And also with your mock drills, you get to determine what wasn't working, like, oh, we didn't think about that moment, so that they can be corrected before you ever have to test them in a real disaster. Everybody should participate in basic emergency preparedness training and drills, no matter what the role is, because you may be called upon to do something during an actual disaster. Joint Commission mandates that the hospitals conduct at least 2 disaster drills a year. According to the Joint Commission, these drills must occur a minimum of 4 months apart. Please check for whatever kind of agency you are working with or organization as to whether there's any particular standards that you must follow. So these drills also must include all departments and legal agencies that would be involved in a real emergency, and the drills must include practice, treatment, and transportation exercises. That's why often as students you're invited to participate in mock drills and you become victims and usually have a name tag that says what's going on with you, so they can act accordingly when they really tag you to determine what priority you are. And additionally, both staff and the plan must be evaluated at least once a year. So when disaster happens or any kind of crisis, you will activate the Incident Command Center that I've been talking about. Some also refer to these as your disaster committee. Each member has a specific management duty during that and directly following a disaster as set forth in your facility's disaster or emergency preparedness plan. Many ask what an organizational chart might look like. There's lots of examples online. Here's a relatively simple and straightforward one where you have your organization incident commander. Your public information officer and your safety officer will be working side by side. You'll have a liaison officer, and then you'll have people that take care of different aspects of what's going on in your disaster, from operations to the financial implications of a disaster. So what are the roles of your disaster or incident committee? So you have an incident commander, and that person is responsible for calling together the hospital disaster committee when a crisis event occurs. You will also have your section chiefs. They will, as I shared in the earlier slides showing the little boxes of the organizational structure, they'll do logistics, planning, finance, and operations. And then you've got all of your directors. So people that normally direct different kinds of units within your organization in their areas, they will continue to do their work and they will report to the designated section chief. And unit leaders. So these are people that are very specific in their task, everything from nutritional needs, who's getting fed what, to whether people need to be transported to different places. Materials and supplies become critically important, who's working with the labor pool to make sure you've got enough staff on duty, of all the various kinds of staff. And again, your unit leaders report to a designated director. And then finally, your area officers. So they also have specified assignments such as your PIO, your safety and security officer, your liaison, your patient tracking, your information officer. So all these very specific roles carry specific duties. So when you think about putting together a disaster committee or a crisis incident committee, these are often the types of individuals, particularly in a hospital type setting. Again, reflect on the type of setting you're in and what makes sense for you as to who would be part of that disaster committee. But this is just one example. So when we learn of a disaster, the first person on the scene, recall the planning P, the first person on the scene will typically serve as the incident commander. Often this will be the fire department personnel or your police, whoever ends up on that scene first until they're relieved by a more senior person. That's at that location. Of course, back in your organization, you will also have your incident commander individual. But say you are that first party on the scene, or your organization is often one that's first there. What happens? So you take the appropriate personal protective measures by all means. You notify supervisory personnel or incident commander of the incident, and you advise personnel in the area of any potential threat and or you might begin evacuation procedures. So, other key roles as the disaster occurs. Again, I've already talked about the first person on the scene. And then you need to restrict access to that scene and surrounding area as the situation demands, and take any other steps necessary to minimize any threat to health and safety. Most likely, you will be requiring medical assistance, especially in a community-involved disaster. And you will coordinate your further response actions with the incident commander and the local responders. Okay, so that's what happens at the scene. So when you're part of an organization and you learn of a disaster that will impact you, again, you activate your emergency response team, may go by different titles. You look at the severity, potential impact, any safety concerns you have, and what response requirements based on what information you receive by that first person on the scene. And then you determine what are you going to need in your organization to keep everybody safe. Personal protective equipment, much as we've seen with the coronavirus, the sources of ignition if it was a fire-caused incident, and the potential need for evacuation, again, as we've discussed in earlier lectures, say if the floodwaters are coming. You will communicate and provide incident briefings to your superiors as appropriate, and also additional internal and external notifications. And as the situation demands, you will be in touch with the emergency response team. So activation, there's a lot of different examples, again, that you can find through the World Wide Web. Here's one sheet if you want to enlarge and look at an incident commander sheet. But you'll activate your hospital incident management team, you'll activate the needed positions, and each director will activate what they need. And you'll provide job action sheets to each activated position, and we can talk more about that. You'll provide activity logs to each activated position. So each activated position initiates the log to document basic incident activity and details that are notable, as well as providing position identification. So assessment. You'll do your initial incident briefing. You'll determine what your objectives are. For the safety officer, they are thinking about your patients, visitors, and staff, both their health and safety, highest priority. Your section directors will engage their appropriate roles. The infrastructure and operations director will provide facility system status reports. And as it goes on, you'll do your situational status reports as needed. Remember, again, the planning P for guidance on some of these activities. So your response plan. So you'll gather all the reports from the Disaster Incident Committee team members, and then you'll activate additional or relevant specialty plans. I've given a number of examples here. So currently we're in a pandemic, and there are very specific plans that have been put in place and initially probably improvised, but certainly they have been tailored now to understand what different parts of the country have learned, having already experienced it, so that the other parts of the country that are now starting to have more cases can better understand and have some good recommended solutions in the first place. So notifications. We will, again, talk more about this under communications, but for now, just remember you're going to need to activate redundant communication modalities. And why is that? Because some of the types of communication that we normally use may not be available due to whatever the nature of the disaster was. And we talk about voice, radio, and any other data systems that you've got in place. As much as possible, you will utilize your facility's internal system to declare emergency codes, so know what those are, and then everybody internally will get notified as to what they need to know. So tracking. This is an important piece of managing a disaster or crisis. There will be somebody assigned to that role as the manager of tracking for disaster victim and patients, triage, treatment, disposition. They'll keep a record of the personnel time. They'll keep a record of the volunteers. Procurement leaders will be tracked by period or entire incident, depending on how long the incident lasts. You'll have an accounting record, request, distribution, return, and condition. And we'll discuss casualty and fatality in the next slide. And then again, if evacuation, very important also to track where patients are going. Any staff injuries, and of course, finance needs to keep track of everything that's expended on behalf of the incident. So if you are able to do billing, you'll be able to conduct that so the organization survives. So when you look at your casualty and fatality details, so for each operational period, as you can see on this example, you can look at your casualties, fatalities, who was seen, who was admitted, who's considered critical, etc. And resource requests. In case of need for additional equipment, staff, or personal protective equipment, you'll work through whatever agreements you have with other organizations. You'll direct your resource requests. Your need is immediate, or your supply is exhausted, or it's not available from your normal sources. And again, you'll need to define all those aspects listed from priority to delivery information. And that is the end of Module 3, Part 1.